This video is an overview of dementia. Most people think of Alzheimer's disease when they think of dementia, but there are other types of dementia, such as vascular dementia, dementia with Lewy bodies, and frontotemporal dementia. Before we go over the different types, let's define what is meant by dementia. Dementia is a decline in memory and other mental abilities, including memory loss, difficulty in communication, anxiety, hallucinations, mood swings, and confusion. These symptoms are progressive, and although treatment can help, there is no cure. Dementia is very common, especially in the aging population. Alzheimer's is by far the most common form of dementia, ranging from 50 to 75%, followed by vascular at 20 to 30%, Lewy body at 10 to 25%, and finally, frontotemporal dementia at 10 to 15%. The most common symptoms of Alzheimer's disease are short-term memory loss and word-finding difficulties. They also have visual spatial difficulties, resulting in getting lost easily. There are problems with insight, reasoning, and judgment. Although all parts of the brain show atrophy, it is most pronounced in the hippocampus. Vascular dementia is caused by changes in the blood supply to the brain, especially in the smaller blood vessels. When the blood supply is decreased significantly, mini-strokes occur. So, the symptoms of this dementia depend on where these mini-strokes happen. Because vascular dementia causes a series of small strokes, it is progressive. Some of the risk factors for vascular dementia are high blood pressure, smoking, atrial fibrillation, and diabetes. Dementia with Lewy bodies causes visual hallucinations in people with Parkinsonism, a disease with tremors, and rigid muscles. Besides vivid hallucinations, there are also problems with attention, executive function, and organization. Lewy bodies are conglomerations of proteins inside the neuron that interfere with the neuron's normal functioning and contributes to Parkinson's disease. Frontotemporal dementia presents with drastic personality changes, apathy, and language difficulties, with social withdrawal and lack of insight seen early in the disease process. There are 6 main types of frontotemporal dementia. One is the behavior variant. There are 2 that present with language problems as a main symptom. Progressive supranuclear palsy presents with difficulty moving the eyes. Corticobasal degeneration presents with difficulty in using one limb. And frontotemporal dementia with motor neuron death, as similarly seen in amyotrophic lateral sclerosis. Dementia goes through stages: mild, early, middle, and late. Mild cognitive impairment has subtle symptoms that do not impact daily function. These symptoms are often seen in retrospect when the person claims these problems started years ago. The symptoms are often forgetfulness and problems with finding words. Early stage dementia is when the symptoms start being noticeable to others and they start to interfere with daily activities, especially activities like cooking and grocery shopping. There may be difficulty in managing the finances for the household as well. Middle stages show a steady progression of symptoms with impairment of problem solving and judgment. These people generally cannot function well outside the house and should not be left alone. They may need assistance in personal care and hygiene. Late-stage dementia requires assistance in most all activities. The person needs 24-hour care to ensure safety, and they may wander off if they're not watched. They tend to have swallowing difficulties and require pureed foods and thickened liquids, and the person may stop eating altogether. This ends the overview video on dementia.